Hello friends, welcome back to PLAB 2 NHS channel. In this video, we will be deep diving into testicular examination, but before doing so, let's revise very quickly how to swiftly take history in such stations.
So when you're taking a medical history, of course, it's a testicular pain or it could be a testicular lump, but it could be a pain. So either Socrates or Ardpara, go with that very quickly. Start with the questions of finding the cause, whether it's a trauma, if they're having any urinary problems, red flags and constitutional symptoms. So constitutional symptoms are basically about the weight loss. Okay, constitutional symptoms is about the weight loss. You will be asking about any lumps or bumps anywhere, any anorexia, and any night sweats and fever. Such things are constitutional symptoms. Risk factors: has he traveled recently? Any instrumentation, lifting of heavy weights, and constipation, and his general lifestyle. Sexual history, very, very important in the testicular station. Of course, you guys know that. So recent sexual activity: have you been using any protection? How many partners, one or multiple, and what's their sex, male, female, or both? Past medical history with the similar complaints, any medical conditions that you know of. Are you taking any medications on a regular basis, and any allergies that you are aware of? Ask about the social history. In the social history, don't forget to ask about family, work, and how has it affected on his day-to-day life. Very, very important. And any medical station, do not forget the ice question very quickly. Okay, very quickly. Very important to elicit ice because that shows that you have got the IPS. So when you're going into the testicular examination, so we will basically be having 8 steps that I have divided into. First is to introduce and to gain consent. Second is exposure and chaperone. Third is to inspect first the penis and then the scrotum. Fourth is to palpate each testicle, epididymis, and the spermatic cord. Right? The fifth is to finding the abnormality. So when I tell you about finding the abnormality, I'll explain what do I mean by that. Then 6 goes on the special examination, ask the patient to cough for the cough impulse to look for any hernias, front tests to elicit the pain when you lift it, and any transsimulation test to look for any varicocele. Found a lump. In case if you did found a lump, definitely describe the lump as quickly as you can. Don't go into too much of details about describing just because you have read everything in the notes, because you will not have so much of time to do that. And 8, cover back the patient and thanks the patient for letting you examine. Okay, so now once we go into the detail, the first thing, wash your hands. Of course, there is nothing to wash there, but ideally you should wash your hands. Introduce yourself to the patient there that you will be doing this and this test. It might cause some pain, but you will be as gentle as possible. Take his consent if he's okay with it, and then proceed with the examination. So the exposure, how are you going to get the exposure? The first, we know that the patient should be exposed from the waist down and up till the mid of the thigh. Most importantly, if possible, then he should not be wearing anything down below. Okay, and his shirt should be pulled up. It should not be there if he is wearing the shirt. Of course, in the mannequin, these things will not be done, will not be there. But if there is a small sheet which is covering it, make sure to completely remove it, and make sure if the mannequin is lying down, make sure to rest it in a standing position, because remember, testicular examination is best performed with the patient standing up. Okay, so if the mannequin is lying down, don't be afraid to lift the mannequin and put it in the standing position. Ask the patient before you do that I would like you to be in the standing position, if that's okay. He says yes, put the mannequin into the standing position. Okay, and remember, it's always good that you should not just bend, but you should kneel down, because the mannequin will be kept on the table, and if you kneel down, it will be easier for you to lift both of the testicles to look at the back of it. Okay, but if you bend down, then you'll have to bend down too much, which is not an ideal position to do the examination. So kneel down if possible you can. Okay, always start with a thorough inspection. Okay, so first inspect the penis on all sides. Note for any obvious lumps, any swellings, any ulcers, or any scars. Okay, that's very important. After you have done inspecting the penis, make sure that you start inspecting the scrotum. So it is easier to do the inspection of the scrotum. Always try to move the penis to the left when you're looking for the right. Right side of move your penis to the right side if you're looking on the scrotum on the left. So just try to move the penis on either side to move it out of the way. Or you could ask the patient that if you can do that. If the patient says yes doctor, or you can do it, then you do it yourself. But before moving, ask the patient if he can move the penis towards one side, towards his left or towards your left. Again, inspect all the sides of the scrotum, not forgetting to lift it so that you can inspect the posterior part of the scrotum as well. As I said, if you kneel down, you will be in a very good position that even if you lift it very low, very slow and very less, you will still be able to see at the posterior aspect of the scrotum. And if you are just bending down, it might be a bit difficult. What you will be noting in the scrotum? You'll be noting for any lumps, swelling, ulcers, and obvious scars. Nothing there. Move on to palpation. Okay, now you should palpate each of the testicles individually. Okay, we'll see the video of the testicular examination. I've got two videos. We'll look both of the videos and we'll see how do they do the examination. Okay, so if you have identified or have been told about any abnormalities, examine the normal side first. Let's suppose if the patient is saying you are trying to inspect, when you're trying to palpate the right side, the patient says, doctor, I'm having pain. Say sorry, leave it, ask the patient if you can try again. Do not leave on the first instance that he's having a pain. Say sorry, ask the patient if you can try again. Try again, touch it. If he still says pain, tell sorry once again, and then move on to the left side. And then when you try to examine the normal side, use it with a bimanual technique. So using a thumb and your index finger of each of the hand, use both the hands very gently, feel the whole testicle, noting for any palpable abnormalities. If you don't feel there is any abnormality, ask the patient if he is experiencing any pain while you are doing it. Okay, that's very important. Remember, in cases of hydrocele, sometimes it will be very difficult for you to palpate the testicles. And if you're not able to palpate, it will be very difficult to find the course of the inguinal ligament and to feel the inguinal ligament. But for the other side of the testicle, which is a normal testicle, feel the testicles, palpate it really well, feel along the course of the inguinal ligament to see if there is any undescended testicles present. Okay, if you cannot feel, it can be a hydrocele, or maybe you cannot feel at all. Okay, now next you should be able to palpate the epididymitis, and you should also be doing the spermatic cord on both the sides. So you need to again trace the course of the inguinal ligament. Then you need to look for the epididymis and the spermatic cord on both the sides. Comment on them if you are able to do it or if you're not able to do it. If you do not feel any abnormality, ask yourself 5 questions. Can I get above the lump? If you can, if you cannot, that will matter, because again, it will differentiate between different types of diseases. Is the testicles separate from the lump? If you have got a lump, ask yourself a question. Is the testicle different from the lump? Can you measure the lump, or can you palpate the lump differently? And can you also palpate the testicles differently on the same side? If you can, again, it will tell what kind of a tumor or what kind of a growth you are having. Ask the patient to cough, very important. And while coughing, look for any cough impulse. Look for any swelling while the patient is coughing in the abdomen region and also in the inguinal region. Now use a torch lamp, because a torch lamp will be kept there, a torchlight pen, a torch pen. Use it to trans-illuminate both of the testicles, looking for any hydrocele. How will you describe the lump? So the lump can be described in a various ways. We'll talk about it. Usually hard, soft, regular, irregular. Is it like a bag of worms? What is the size of the lump, and etc. Okay. And when you have finished your examination, cover back the mannequin. Do not forget. Thanks for him. Come back and sit down. Start talking about what about your differential diagnosis and what have you found out from his examination and from his history that you have taken. So that is the testicular examination. It's a long station. It doesn't end really well for a lot of candidates. So make sure that you do practice the testicular station again and again. Okay, be very swift, be very quick. Ask the patient every single step that you are going to do. Take the consent and only then proceed. Now, what will be the differential diagnosis when we talk about? So, if it's a testicular tumor, it will be slow in onset. In the history taking part, it will be solid and firm. If it's a hernia, you will feel the impulse with the cuff. And if you do the ring test and epididymitis or orchitis, there will be painful symptom. There will be dysuria. So there will be some urinary symptoms there, fever and some redness, of course. Hydrocele, as we say, that it will be a transilluminate test. And varicocele, again, it will be a dull, dragging sensation pain, worse after work or after standing during the end part of the day. So that is how we can differentiate when we take a history from the patient from the history. Inspection, skin changes, scars, masses, bruising, and perineum, as I said. And for the palpation, each testicles individually, use both the thumbs and fingers. If you find a mass, tell about the site, size, shape, consistency, contour, color, tenderness, temperature, and transillumination. If you don't tell the temperature, that's fine, but tenderness important, site, size, and shape is important. Which site it is, it's on the left side or the right side, how big is it? Tell it roughly is 3 cross 5 or 5 into 5 centimeters or 2 into 2 centimeters in size. What is the shape? Is it like rounded? It's oval? It's regular, irregular in consistency? What is the counter? And then talk about the color. If of course you can, what color you can't see the mass which is inside. What color is it? But the testicles itself, the outer covering itself, and then do the transillumination to rule out any hydrocele. Cuff impulse, hernia, transilluminate, hydrocele, palpate the epidermis, special test. So what special test do we do? Transilluminate is one of the special tests. French test, lift the testicles, and if it is still painful, very strongly suggestive of epidermis. Cremaster reflex, stroke or pinch the patient's medial thigh and see if it is presenting any elevation in the pain. So that is a cremaster reflex. You can do cremaster reflex, you cannot do cremaster reflex, depends on your discretion. French test is very important, transillumination test, very important, and cough, very important. So at least these three. Cremaster reflex, if you feel that you're running short of time, tell ideally I would like to do a cremaster reflex as well, and complete your examination. Do not get stuck. Do not get stuck in any of these situations where you feel that, oh, I forgot this examination. If you forgot, you forgot. You don't have time to go back. You have very less time.